So this is a video on fractures. Fractures are found on page 661 of your textbook. They're pretty straightforward. You probably already know most everything about them already. So what is a fracture? A fracture is any variety of broken bone. It's any way that it's a defect in the continuity of bone. So it can be a small crack, it can be a complex fracture in multiple segments, it can be compounded with soft tissue damage, etc., etc. Um, they in your textbook they talk about fractures classified into three general categories, and I would concur with this. There's the traumatic fractures. They're the fractures that happen because of sudden impact. This is from falls or car accidents or um, um, just sudden impact, abuse, that kind of thing. Um, there is fractures that are stress or fatigue fractures, and this is from repeated use and bending in the exact same spot. And the third type is a pathologic fracture. And that's a fracture in bone weakened by disease, like osteoporosis or cancer or something like that. So there's lots of risk factors. Box 17.7 on page 161 has got a, a list of risk fractures or of risk factors for fractures. So trauma and how much trauma you get. Um, it, we're more prone to fractures as we advance in age, osteoporosis, um, anything like that. Um, Poor health, poor nutrition, alcohol and substance abuse will do it. Radiation treatments for other things. So actually, falling is and risk of falling is the one probably the highest risk for it. So uh, really. Depending on the type of trauma, there's different types of fractures seen. So, like motor vehicle accidents, head injuries, skull, mandible, um, lower limb from falls, hip fractures in older women, that kind of thing, all add up. So, there's different types of fractures. Here's some pictures. This first one here is called a comminuted fracture. This is a fracture where the bone is broken into multiple pieces. Uh, this is not a compound fracture. A compound fracture is when the fracture is compounded by soft tissue damage. Really, it's the ends of the bones are sticking out of the skin, and the problem is going to be compounded with infection or something like that. The one beside it, the next one to the right, this one here, is called a green stick fracture, and it's called that because it's just like trying to break a green stick. The bone will bend, and it'll fracture along the area that has the most stress on it, the most tension on it, but it won't fracture on the compressed side. So it fractures like a green stick. We classify them by their angles. So they're oblique or they're transverse, or if there's a twisting motion, if there's torque put on the shaft, then they'll break in a spiral fracture. This, generally speaking, you see spiral fractures in child abuse and that kind of thing, where it's something where an arm gets twisted. Um, you so all of these are fairly traumatic fractures. The stress fractures, a common one is called a march fracture. It happens in the third metatarsal, and it's from repeated walking or hiking, marching in the military. And it comes from just repeated low-grade stress uh, put in the exact same spot until the structure fatigues. It's very much akin to if you want to say you want to break the end off a coat hanger, you bend it back and forth, back and forth, back and forth, back and forth until it just breaks, until it gives up, and that's the same sort of thing that's called that's called metal fatigue. Now, bone isn't anywhere near as uh, flexible as the metal, so it fatigues much sooner. Uh, Generally speaking, when we see pathological fractures, the pathological fractures happen because of disease entities, usually some sort of an osteopenia or osteoporosis. And often those are compression fractures. It's when the cortical bone gives up and there's not enough trabecular bone to support it. So the bone compresses into itself, especially common in vertebrae or in hips where the head of the femur drives towards the greater trochanter, things like that. Um, so people that engage in high risk behaviors and elderly and people that fall easily are who get them. The signs and symptoms, usually it's obvious. It's painful. Um, uh, but it may just be achy pain if it's a small bone. If it's like if it's a metatarsal or something, it may be more of a deep ache. There's often swelling involved. There's um, yeah. It, so how do you treat it? You treat it by immobilizing, bringing the ends together. And I know in physiology you talked about fracture healing with the hematoma formation invaded by the soft callus and then the hard callus and then the bone remodeling. Uh, it's so what you're trying to do is actually through treatment uh, mimic that or speed that along. So by casting or putting pins, plates, uh, that's called an open reduction. If there's surgery involved, a closed reduction is if it's just casted and the skin isn't opened surgically. Um, all of that is to maintain the alignment and allow the two ends of the bones to join again. Uh, so they are a relative contraindication. I wouldn't work around them while they're acute, because it could actually uh, cause the healing to be delayed. There's all kinds of complications can happen. You can end up with bony deformities because of a malunion. If the two ends of the bones don't meet in alignment again and they heal, you can have a pretty crooked bone. You can have delayed unions where there's it takes a long time to heal, or you can just have non-unions where the two fracture parts just heal up uh, and form a pseudo joint in between. It's pseudoarthrosis. Uh, all of these things can happen. Most of the time, our bodies are very good at just healing them up.